Zepatier is a medication used to treat chronic hepatitis C, which is a viral infection of the liver. It works by reducing the amount of hepatitis C virus in your body, helping your immune system fight the infection and potentially aiding in liver recovery. This product may also be used with certain other medications, such as ribavirin. Chronic hepatitis C infection can lead to serious liver problems, including scarring or liver cancer. It is important to note that it is not known if this treatment can prevent the passing of the virus to others. It is recommended to not share needles and practice safer sex, including the use of latex condoms, to lower the risk of passing the virus to others. As for the daily dosage and optimal timing, it is best to follow the instructions of your healthcare provider. Before you start taking Zepatier, make sure to read the patient information leaflet from your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once a day. It's best to take Zepatier at the same time each day to keep the amount of the drug in your body at a constant level. This will help the medication work effectively. Remember to take it at evenly spaced intervals. It's important to continue taking Zepatier for the full length of time prescribed, even if your symptoms disappear. Stopping the medication too early may result in a return of the infection. If you experience tiredness, headache, or nausea, it's important to let your doctor or pharmacist know. It's also important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the risks. Most people who use this medication do not experience serious side effects. Although it's rare, a serious allergic reaction to this medication can occur. Seek medical help immediately if you notice symptoms such as rash, swelling, severe dizziness, or difficulty breathing. It's important to note that this is not a complete list of possible side effects, so if you experience any other effects, be sure to contact your doctor or pharmacist. If you're in the US, you can call your doctor for medical advice about side effects or report them to the FDA. In Canada, you can report side effects to Health Canada. And as always, it's important to follow your doctor's guidance on the best time to take this medication and the appropriate dosage for your specific situation. If you have hepatitis C, Zepatier can help treat it. However, it's important to know that it could also cause serious liver problems, although this is rare. In some cases, it may even make other liver problems, like hepatitis B, worse. Before you start taking Zepatier, make sure to tell your doctor if you've ever had hepatitis B or any other liver problems. It's important to be aware of any new or worsening symptoms of liver disease, such as nausea or vomiting that doesn't stop, loss of appetite, stomach pain, dark urine, or yellowing of the eyes or skin. It's important to discuss any concerns with your doctor. As for the daily dosage and timing, it's best to follow your doctor's instructions. They will be able to provide the most accurate information based on your specific situation. Before taking Zepatier, make sure to inform your doctor or pharmacist if you are allergic to Elbasvir or Grazoprevir, or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other issues, so it's important to discuss this with your pharmacist. Also, be sure to inform your doctor or pharmacist about your medical history, especially if you have other liver problems, overuse of alcohol, HIV infection, or diabetes. If you have diabetes, your blood sugar may be lower with hepatitis C treatment, so your doctor may need to adjust your diabetes treatment plan. If you are planning to have surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. During pregnancy, Zepatier should only be used if clearly needed, so it's important to discuss the risks and benefits with your doctor. If Zepatier is used in combination with ribavirin, it must not be used during pregnancy by either the pregnant woman or her male partner, as ribavirin may harm an unborn baby. It is unclear whether the medications in Zepatier pass into breast milk, so consult your doctor before breastfeeding. When taking Zepatier, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription, non-prescription drugs, and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. There are certain medications that can affect how Zepatier is removed from your body, which may impact its effectiveness. These include azole antifungals, such as ketoconazole, bosentan, cyclosporin, efavirenz, atravirine, modafinil, nafcillin, HIV protease inhibitors, such as atazanavir, saquinavir, rifamycins, such as rifampin, certain drugs used to treat seizures, such as carbamazepine, phenytoin, and St. John's wort, among others. It's important to talk to your doctor about any other medications you are taking before starting Zepatier. Always follow your doctor's instructions and take Zepatier at the recommended dosage and at the best time as directed. If someone has taken too much Zepatier and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. It is important not to share Zepatier with others. Before starting, during, and after treatment, it is important to have lab tests done, such as liver function tests and tests for hepatitis B and C. It is also recommended for female patients or female partners of male patients to take a pregnancy test before starting treatment if they are using Zepatier with ribavirin. Pregnancy tests should continue to be done while using this medication and for some time after this medication is stopped to make sure no pregnancy occurs, for 9 months for female patients and for 6 months for female partners of male patients. If you forget to take a dose of Zepatier, take it as soon as you remember. However, if it is 8 hours or less until your next scheduled dose, then it's best to just skip the missed dose. Make sure to take your next dose at the regular time and do not take a double dose to make up for the missed one. When storing Zepatier, make sure to keep it in its original package at room temperature, away from light and moisture. Do not remove the tablets from the original package to store in a different container. It's important to keep all medications out of reach of children and pets. When it comes to disposing of Zepatier, make sure to do so properly by consulting your pharmacist or local waste disposal company. And remember, do not flush it down the toilet unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.